Hello, Gold participants from around the world. I'm Fleur Bickford, Program Director and MC for Gold Learning. I'm here today with Kathy Parks, who is chatting with us about her upcoming presentation titled Lactation Choices Following Pre- and Perinatal Loss. So Kathy, thank you so much for chatting with us today.
Yes, ma'am.
So I was hoping that you could tell our delegates a little bit more about yourself and your professional journey. I know you've been working in lactation for quite a number of years. Maybe you can just tell us a little bit about how you got into it and what the journey's been like for you.
Well, Fleur, I've been a lactation consultant and international board certified LC since 1992. I received that prior to completing my nursing degree, and I started about 10 years prior to that with a mother-to-mother support group, La Leche League. I knew what I wanted to do before the profession was invented. And it has just been a joy to work toward the credentialing and to continue to work in a field that is my absolute passion. Even if there wasn't a paid profession, I would still be doing this kind of work.
Fantastic. And certainly, your passion comes across even when you're talking about it, which is fantastic. Now, your topic, going to be talking about pregnancy loss, which is always a difficult topic, but really an important one and one that I think just doesn't get talked about enough because it is such a hard topic. But one thing that I was really interested about when I was reading your bio was you mentioned the Grief Share program that you manage in your community. I was wondering if you could tell us a little more about that.
I can. This particular program, Grief Share, is run through the church that I attend in San Antonio. I also am in the process of forming a grief support group for the moms at the hospital where I work. It's these groups that moms get to come to and discuss feelings, problems that are occurring, um, inappropriate things that are shared with them by other people who mean well following a loss during pregnancy or in the postpartum period or even several years later. I've worked with several moms who've lost 9-month-olds to SIDS. And dealing with those types of topics is very difficult. And by that time, friends and family have stopped talking about the baby because it's over and done with and we want to get on with our lives. And it's a self preservation mode. Helping staff is another thing that I do. It's very difficult. We are often drawn to the birthing and breastfeeding fields because we have compassion and because it's a joyful field. However, when a loss occurs, that can be way too personal for too many people. And I help the staff deal with how do I overcome that, take care of myself, still providing the support that needs to be received by the mother or parents.
Okay, thank you so much for that, Kathy. Um, as we just finish up here, hoping you can tell us a little bit about what you hope delegates will take away from your presentation and be able to take with them back to their own workplaces.
Certainly. My hope is that delegates learn that simply suppressing the milk supply is not the only choice, and moms can choose other things. For example, donating milk to a milk bank. It's a very challenging topic to broach with new moms that have just lost a baby, but it's often one that is extremely emotionally beneficial to this particular mom. So we're going to talk a little bit about those types of choices.
Wonderful. Thank you. And definitely looking forward to your presentation. For our delegates who are listening, you'll be able to hear more from Kathy as part of the Breastfeeding Essentials add-on package that we're offering with the Midwifery 2016 conference. So be sure to check that out. And thank you everyone for listening, and we will see you soon.